So there's a place for braces and clear aligners, right? I have some patients where I offer, and they'll say, I just want the metal on because I don't trust myself with the clear aligners, right? Okay, so clear aligners to work to be efficient must be on the teeth. The only times that they're off the teeth is when you're either brushing your teeth or you're eating. If you leave them in the kitchen, leave them in the bathroom sink, the teeth are not moving. So they have to be on the teeth to work. So that's the downside. Whereas the metal, if they are on, once they're on the teeth, they're constantly working, and it's not something that you have to remember. So you have to be disciplined to remember that. People take them out when they're eating with their friends, put it on a tray, gone. They're like, oh, shoot, I'm missing something. Oh my God, my aligners. By the time they go back, they're in the trash. So now you gotta get with your dentist, however long that takes. You've had no movement in that time because the retainers are not on the teeth. It's good for a responsible person who's not gonna forget, and people who need inconspicuous look. You know, they can't afford to have the metal on the teeth. The metal still has a place. It is the workhorse. It is the tried, true, tested method of straightening the teeth. And then we have the ceramics. So the ceramic braces are the clear ones, but they're very dainty. You think about a ceramic dish, you know, you gotta be really careful with them because they break. They also tend to pick up stains more. They're less forgiving. If you love pasta, if you love red sauce, or you want to indulge in some Cheetos, or you like curry, you know, depending on your diet. So you got to think about those things. Drink a lot of red wine. So everybody has their place, and they've made where the clear aligners are good for the younger kids now. Like some of the systems offer a teen line of clear aligners. So, you know, there's a place for each one. So a lot of times to get to which is the best product, you know, we'll ask the patients some questions. And then some patients would downright just be like, oh no, put them on because I'm not gonna remember. I don't want the responsibility. Ew, I don't wanna be in my mouth taking these out. I've had patients like that. So, you know, it varies. But I mean, if you have something you wanna tweak, that's a quick fix, the aligners are awesome because you just wear them for a few and then all of a sudden your teeth are corrected.
Let's say like just someone who is coming in, like how would that process work of someone who, you know, knows that they need some sort of alignment fixture? Do they just schedule an appointment and come in and then you kind of like assess their teeth? How would that
Right,
work?
so they would say that they are interested in braces, and I do a pre-screening. So I'll kind of look at their teeth, see, because there are limitations, right, to each one. So I'll kind of assess their teeth, look what class they are, what type of bite they have. Then I'll literally ask them, you know, give them a mirror and literally be like, what don't you like about your teeth? Because at the end of the day, I still want to fix what they don't like. I don't want to fix their bite. If they have bucky teeth and it doesn't bother them and they just want to twist this tooth and I fix that, they're gonna be like, I didn't come in here for that. So I give them a mirror so we can make sure that we're on the same page with what they want to fix. And if I do see that it's kind of bucky or the front teeth stick out, then at that point I'm going to say, you know, would you be okay if we fix that? And if they say, I don't want that fix. I had a patient like that. I don't want that fix. And I'm like, what? It's like way out. And she was okay with it. She loved her look. We straightened and got her out. And to this day, she's still happy with all this overjet. And I'm like, okay, you know, but they're perfectly straight and that's what she wanted. So I've learned that over time that you always want to ask. So they'll come in, we'll do the pre-assessment, I will pre-screen them, see what they need, what they want. And then at that point, if they're ready that day and time permits, we take records. So records are, we take two types of specialized x-rays, we take pictures, and we take molds of the teeth so I can look at the teeth while they're not there. And in some instances, we'll actually digitally scan the teeth. So if we're doing aligners, most of the time we'll digitally scan the teeth because I don't need molds for that. Because with digital scan, you want it to be super, super detailed and very, very accurate. So now that we have technology that can give us more accurate, we digitally scan the teeth. And then once I've looked at everything and I have a plan for them, I bring them back. I will tell them what it's gonna cost, how long it's gonna take, And of course they'll address, do they have to pull any teeth, and is it gonna hurt? And then we go over all those things so the expectations are understood, usually with the parent, if they're a child, or with the adult. And then they usually see their before pictures, and a lot of times I'll get back, I didn't know my teeth looked like that. Oh my goodness, so a lot of times they just see here. And then when they see from all the different angles that we take to be able to make sure we're giving them the best plan, that's really eye-opening for them too. And then sometimes they'll say, well, can you fix that? Things that they never addressed with just a mirror. So it's also to make sure that before we start, are we on the same page with what you want to do? Because it's almost impossible to reverse it if we've fixed it, and hopefully they want to fix that. So it's pretty seamless. And then they'll schedule. And then also too, if they can't come in, I just Zoom with them.
Okay.
And just, show them really quickly. And, I've done it a lot, so it's pretty smooth. And then I'll pass them on to the treatment person to schedule them and go over the finances.